Pros in the know start with Lowe's, because at Lowe's, pros save big on the supplies they use most. Right now, save even more on select concrete mix, now 30% off when you buy in bulk. Plus, save 5% on eligible purchases every day when you use your Lowe's Business Credit account. Stop by or visit lowesforpros.com for details. So, Pro, now that you know, start with Lowe's. Minimum purchase required. Selection varies by location. Credit offer subject to credit approval. Can't be combined with other credit offers. Exclusions apply. U.S. only.
Hey, ladies and gentlemen, this is Dr. Ron here, host of Dr. Ron Unfiltered, Uncensored, brought to you every Tuesday at 4 p.m. Welcome. We will be joined today by Dr. Jerry Smith, and of course we have the inimitable Dr. William Wong, who will be our guest today. So with that being said, ladies and gentlemen, with an attitude of gratitude, I want to welcome you today. Remember that feeling an attitude of gratitude makes us see things from a more optimistic point of view, and being optimistic has been shown to lower blood pressure, help you get a better night's sleep, and increase longevity. How about that? It also helps you bounce back faster from stressful situations. So let's keep a few people happy by stating that this program contains general medical information. The medical information heard on this program is not advice and should not be treated as such. The information is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. You should never delay seeking medical advice, disregard medical advice, or discontinue medical treatment because of information heard on this program. You're encouraged to confirm any information obtained from this program with other sources and review all information regarding any medical condition for treatment with your physician. So thank you for putting up with that. I just want to introduce the program today by reminding you that last week we talked about a town in Italy, Acciaroli, where more than 10% of the population lives to be 100. And remember, I told you that they have low levels of adrenal hormones today. They have good circulation. But remember also that it was stated that sexual activity among the elderly appears to be rampant. Maybe living long has something to do with that. So this topic today is very apropos. And remember, ladies and gentlemen, life is too short for drama or petty things. So laugh hard, love truly, forgive quickly, live while you are alive, forgive now those who made you cry. You might not get a second time. With that, ladies and gentlemen, let me introduce Dr. Jerry Smith, freshly back from Ontario, Canada.
Thank you. Yeah, and as apropos, they always say, once a king, always a king, but once a night's enough.
With that, let's introduce Dr. William Wong. Ladies and gentlemen, I don't have enough time, and I don't want to take time in the program to tell you all this man's accomplishments, but he's a naturopathic physician. He's a PhD. And Dr. Wong, you're there. Why don't you tell our audience something about your history?
Oh, gosh. I labored in obscurity for about 20 plus years as a naturopath, coming up with all sorts of really wacky stuff that even naturopaths thought was really nuts. Turned out that all of it worked, but I couldn't get any of it out to the general public. Then I met the gal of my dreams, who also turned out to be a business genius, and she started coming up with ideas on how to get all the things that I had come up with, invented, discovered, whatever, out to the general public, and that's what we do. As a naturopath, I basically worked with sports medicine and then went into general rehabilitation. My PhD is in exercise physiology, and I applied the same principles that I had done with athletes from Pee Wee to pro football to Olympic level to rehabilitate rehabilitating seniors with knee replacements. So same principles, different intensity, and the same nutritional healing and the same exercises and stuff. So I came up with a rather comprehensive way. Also discovered that all of the programs that folks had developed to rehab lower backs were developed by people who never had a backache. So all these things I can't take full credit for. No one would ever know about them. You guys wouldn't be talking to me now without my wife.
Excellent. Well, thank you, Mrs. Wong. So Dr. Wong, I think what the hook was today when people saw our advertisement was they're talking about the essentials for sex, and just on the male side, we know that research findings suggest that sooner or later all men get testosterone deficient. The age-related decline in testosterone secretion starts early, between the ages of 25 to 36. That is incredible.
Yeah, there's a reason why Guyton tells us that old age begins at 27.
And that's one. Is there another reason?
Yes, actually. Between 25 and 27 is when our pancreas decreases the excretion of proteolytic hormones. Proteolytic enzymes. So the decline in hormones happens at the exact same time as the decline in enzyme production.
Well, that, ladies and gentlemen, is a program you want to listen to on systemic enzymes 2 weeks ago. So if this is 281, that would be program 279. Well, testosterone deficiency starts early. I think it's misdiagnosed most of the time by allopathic physicians because
Absolutely.
They're going by what they think is normal, and this quote-unquote normal is not normal.
Right.
And I had just for numbers purposes, you lose 115,000 Leydig cells per year, 300 Leydig cells net loss per day, 15 per hour, and one just listening to this first 5 minutes. You lost a Leydig cell.
So we're all in trouble.
That's so sad. Oh my God.
It is sad. So you know what? Let's just jump into it, and then we'll go from there. I want to talk about some tests, maybe the testosterone, the free testosterone, the serum binding globulin, what maybe some of our listeners might want to get. But why don't you start it off from your perspective of what do you need as building blocks beside drugs now, or in addition to drugs, to have a well-functioning sexual life?
Well, first, let me make the observation that while most of the folks in naturopathic and alternative medicine say that we could live 120 years, we could live X number of years, and there are documented cases of guys in China and India living through 3 centuries to 200 and change. We basically have a built-in mechanism for obsolescence. If I had to make the observation, I would say that we make a finite amount of testosterone in our lifetime. As you say, we have the death of all of these cells starting at 25. So we're meant to be here for a while. We're meant to reproduce. We're meant to replicate ourselves, and then we're meant to get the hell off the planet. So, while we may not want to comply with that, that's the way we're designed at present. That may change one day with folks monkeying around with DNA, but right now, that's the way it is. So what we need to do is make sure, number one, that we don't throw in anything early in our lives to make it even worse, and that we do the things throughout our lives, starting at a young age, to make sure that we can maintain high levels of performance well into middle age and our senior years. I used to call it old age until I became a senior. Now it's senior years.
Now it's young.
Yeah.
To me, 120 is old.
My friends, when I was back in my teens and early to mid-20s, thought I was absolutely raving nuts because I was already experimenting with herbal aphrodisiacs and herbal testosterone builders and herbal this and herbal that. And they what do you need that for? Oh, well, yeah, this works and this works, but wow, if I take this, it's even better. They just didn't get it. And the point here is we should start as young as we possibly can to maintain ourselves, not just through exercise, but physiologically, to support the tissues. What happens if we can make the Leydig cells live longer? What happens if we can maintain our capacity to make luteinizing hormone longer? Then we'll have a longer sex life. We'll have a longer period of making testosterone. And since testosterone is the hormone that keeps men and women young, estrogen is the hormone that brings us into inflammation, fibrosis, and death. It behooves us to maintain as high a level of testosterone within the physiologic norms as possible throughout our lives so that we are as young and as healthy and as strong and as able as we can possibly be throughout that time.
Absolutely. And
I just wanted to throw in one of the problems I find, Dr. Wong, is low thyroid. I mean,
oh gosh, yes.
I was nailed as a baby. They used radiation on me to shrink my thymus gland. They destroyed part of my thyroid, so I'm really clued into this thing. But darn hypothyroidism, the chlorine, the fluoride, the bromide, the mercury, it's all suppressing it, plus the damn diets and refined foods.
Yes.
So we're behind the 8 ball just from those general factors.
Exactly. When it comes to thyroid, low normal ain't normal. And even normal may be low if you're looking at normal for your age instead of normal for an 18-year-old. There's one fellow, I forget, he's one of the great granddaddies of the anti-aging movement, and I apologize to him for not remembering his name, said that everyone over 40, 45, 50 needs to be on thyroxine, period. Just as one of the foundational things for an anti-aging program. Since the thyroid has no ribosomes, we can't make it regenerate, we can't make it grow, unless probably one of the new stem cells therapies can probably do it, but up to now we haven't been able to do it. So we have to replace the thyroxine. Some folks try to do that by supercharging, by taking like 15 grams of Lugol solution a day. My warning to those folks is that if they've got an engine with 8 cylinders and 2 cylinders aren't working, but they rev up the remaining 6 to the point where it'll do the work of 8, how long will that engine last?
We need Lucas preservative. That's why.
So if we take this one anti-aging doc's advice, and when a patient's 40, 45, 50, we start them on a grain or two of Armor, or 50 milligrams of levothyroxine. Honestly, I like the Synthroid better. But I get lots of flack on that. But still, regardless, if we take an anti-aging patient and we bring up their thyroxine, all of a sudden they're peppier, they're sharper, their brains work better, they're losing weight, and they feel better. Holy cow! We've just taken away half of the symptoms of old age.
All right, so let me just make one. Levothyroxine is micrograms, so ladies and gentlemen, don't take milligrams.
I'm sorry, yes. I'm sorry, yes.
Well, they can levitate then, right?
yeah. If you take 100 milligrams of Synthroid, you'll probably be flying through the roof. You'll be running marathons.
Yeah, just from the medical side, 100 micrograms of the Synthroid is equal to 1 grain or 65 milligrams of the Armor, or Nature Throid, or any other natural preparations. But I think that's
Wong,
all.
I just wanted to
foundation.
throw in 2 cents worth here. a lot of dental problems create hypothyroid situations.
Gosh, yes.
And the doctors and the dentists, most of them don't have a clue about it. I mean, periodontitis, gum infections, toxic root canal teeth, post-extraction sites like wisdom teeth or other teeth that are removed that still have infections in the jawbone. The lymphatic system in the mouth drains all that into the darn thyroid, and they're not dealing with that issue.
We, of everywhere that alternative and natural medicine has advanced, I think dentistry is one of the last places it's gotten to. Sure.
That's because they're brain dead from the fluoride
and the mercury.
And the mercury.
The mercury, right?
This might be a good time.
Dentist in a week.
This might be a good time to remind our listeners about mercury. We had a marvelous specialist on mercury and she said, when you put your cell phone up to your ear, you open up the blood-brain barrier to mercury. So, ladies and gentlemen, please be reminded of that. Okay, so...
Is that why I'm constantly losing my cell phone? It's Freudian, right? I'm constantly losing my cell phone, so it must be Freudian.
Yeah, it could be right. All right. So we have a basis maybe for having thyroid issues and testosterone issues, and these testosterone issues. I just want to remind our audience that they start early at age 30 at least, maybe 30, and my opinion is, and we'll see what Dr. Wong says, they probably should be treated before you get actual disease, before you get the actual symptoms, which could be somatic, they could be physical symptoms or mental symptoms. So why don't we go from there, Dr. Wong?
Sure. The late strength coach, Dr. Charles Polkman, who just passed on about 2-3 weeks ago, after working with thousands of Olympians, after working with probably tens of thousands of high-level athletes in his time, made a statement. He said, 31 is the new 50. And I tend to agree. If you think back to your great-grandfather, the statistics tell us, actually, the Army records tell us, average height in World War II, the average uniform size, was for a fellow who was 6 to 6'2", average about 160 to 180 pounds of body weight. You got to figure most of these kids were about, 18, 19. And then the Great Depression happened, and then all of a sudden we got puny because the average uniform size in World War II, did I say World War II initially? World War I, the average uniform size was 6 foot to 6'2". Okay, in World War II, after the Great Depression, what history books don't tell us is that there was such mass starvation in the U.S. that about 7.5 million people died of famine. But the uniform size went to 5'5" to 5'8", and the average weight was about 120 to 130. Think of the massive loss of body size, body mass, and strength between World War I and World War II. We recovered a bit, the stats tell us, somewhere around Vietnam. Average size was about 5'8", maybe a little bit taller. Average weight was I think 140, 150. So the strongest Americans have ever been was right around 1900. Since then, we've had a number of challenges that have weakened us, decreased our bone density, decreased our muscle mass, and probably decreased our IQ. Average American IQ in 1960, when JFK was elected, was 110. Average American IQ now is 90. So we've had many challenges. Some of them of our own making, some of them not. We have to take these things into consideration when we formulate a plan for anti-aging, when we formulate a plan to maintain ourselves. The World War I generation a friend of mine was the youngest flight surgeon in the Luftwaffe in World War II. He was a physician twice over. He went to Max Planck, got his MD degree there. Then he went to University of Bolzano, got another MD degree there when he was serving with the Italians in the Second World War. But he told me that his father had sexual abilities straight into his 70s without any help, without whatever. He could make young girls scream, blah, blah, blah. That seems to have been common back then. I knew a bunch of World War I vets that I just used to hang around because I loved hearing their stories. And that seems to have been common back then. Somewhere after the Great Depression, we started aging faster, so that by 50, lots of guys couldn't do it. We have to take that decline into consideration. So now we get to the point where, as you brought up, our Leydig cells start dying off about 25. Okay, what can we do herbally to keep that from happening? And this is where all of the ancient Chinese rejuvenation herbs come in: the ginseng, the foti ting, the polygonati multiflorum, the ashwagandha. All of the traditional herbs in both Chinese medicine and Indian Ayurvedic medicine to maintain youth and to maintain strength are the ones that we should apply early on in life, in our 20s, in our early 30s. And then we need to go for stronger stuff and combinations of stuff starting at 35 on. And then from about 45 on, we're going to have to start throwing in some meds as well, because the decline, if you haven't, for the folks who haven't taken care of themselves, the decline will be such in certain areas that it won't be reversible.
Okay. Well, it was interesting. You mentioned about the IQ dropping around in the 60s when JFK was in power. Wasn't that the period they took the iodine out of the bread and all?
Probably, yes. Yeah.
I think the iodine and more fluoride.
They put bromine in.
Yeah.
Yeah, I'm a iodine supplementation, and while I criticize the folks who are on 15 grams of Lugol a day, I recognize the fact that we need to throw in the stuff to make thyroxine, or else we just don't make it, or we have a decline in its making. We don't want to have to drag the stuff out of our mineral base, our own mineral base, to make thyroxine. We need to supply it from the outside so that we don't drag ourselves down into mineral decline. Some of the unhealthiest people you'll ever see. I knew a old-timey doc named Davis. This fellow had graduated med school somewhere in 1920s or the 1930s. His first wife had 10 kids. She had so severe mineral decline with each child that she basically died early. He said, "I killed her." Because he gave her 10 kids, and he just basically wore her out. We see that mineral decline in our structure over time in the present in folks who just have a lousy diet. Their bodies are constantly having to scavenge from their own skeletons, attain our mineral physiology. Now, here's a good point. Since the advent of the low cholesterol diet, one of the things that's brought on the epidemic of dementia is that we don't have the saturated fats to make hormones. So what's the largest store of saturated fat in the body? It's your brain. Yeah. So your body will suck the saturated fat out of your brain to make your hormones to keep you alive and keep you going, but it'll shrink your brain.
So bottom line is you get an erection, but you don't know what to do with it.
Where's it go? Oh, gosh. You just reminded me of a story of a derelict I saw on the Bowery that I don't want to repeat. Okay.
All right. So before we get on to the essentials of the that you need for good sexual function, I want to tell a story too. I had a patient before I retired, came in for his consultation after his testing was done, and he said, "Look, doc, you did all the tests. Am I going to live to make it to be 90?" And I said, "Well, do you drink? He said, no. I said, do you party? He said, no. I said, do you eat good meat? He said, no. I said, do you use drugs? He said, no. I said, why do you want to live to be 90?
Exactly.
So let's give our listeners a reason to live to be 90, 100, or 120, as Dr. Jaffe says. Dr. Jaffe says he wants to be 120 and dances his 120th birthday party. So how are our listeners out there, men and women, going to stay young sexually?
Well, there are 4 essentials for having a sex life. When Viagra came out, everyone thought it was just Viagra. It ain't just Viagra. When the testosterone craze started back in the 1990s with Dr. Shipman's book, The Testosterone Syndrome, thank God for him and thank God for his book, then, everyone thought it was just testosterone, but it's actually 4 different things. Testosterone gives us sexual ability and desire. Then we have dopamine, which gives us real desire, like lust in our heart kind of desire. And we have nitric oxide, which we need for erections. But as we get older, over 50, we make a ton of PDE5, which is a little hormone that loves to eat nitric oxide. Now imagine the average half-life of nitric oxide is like 3 seconds. With this hormone, it's less than that. With this enzyme, the PDE5, it's less than that. What if we could put in something that stops the production of PDE5? And what if that something could increase the lifespan, the half-life of nitric oxide from 3 seconds to 3 minutes? So we need the testosterone, we need the dopamine, we need the nitric oxide, and we need the PDE5 inhibitors in a good balance to have. Oh, and then we need fitness, because if you don't have good lower back and abdominal muscles, you can't do the rocking movement to have sex. You got to depend on the gal to do all the work.
No, you do it on the waterbed. You get the motion.
Tried that once back in the 70s. I got seasick. Now, the wave just kept on coming up and breaking my rhythm.
Now, wait a minute. You mentioned dopamine. Isn't that what you try and stimulate in Parkinson patients?
Yes, exactly.
So
yeah,
what does that do to their sex life?
Gives you desire. Dopamine is the hormone of desire. One of the things, and docs used to think I was crazy. When I told people who asked me questions about sexual stuff, when I sent them out for dopamine tests, it's a whole big rigmarole. Back then, you used to have to do it from urine catecholamine. I think there are now tests where there are blood tests for dopamine, and that's great. It makes it easier. But everyone used to ask, why dopamine? We can put in a high physiologic norm of testosterone in a patient. Let's say we have a patient. He's in his mid-50s. All it's doing is hanging down at 6:30 and passing water. It isn't doing anything else. He's not waking up with an erection in the morning, which means he's making no tea at all. So we increase his testosterone level. Let's say free tea is up at the same level as an 18, 20-year-old. Then we give him the Viagra. We give him or we give him the Cialis. Then we give him the arginine or the trimethylglycine or the dimethylglycine, or whatever amino acids to make nitric oxide. And he's got the erection. Now he's got the strength and ability, but he's still not really super horny. It's the dopamine that makes us super horny. And, I had an idea years ago, and I never followed up on it. One of the reasons why men get addicted to porn is because it's a fast release of 2 things, testosterone and dopamine. If the porn is exciting enough for you to watch, then your body will be stimulated to make testosterone and dopamine. And I wondered if we could take Parkinson's patients and find some really raunchy porn for them to watch, if we could improve their followed up on that idea. But
how about the use
you need
of
the dopamine for desire?
Yeah, the phenylalanine is a precursor for dopamine.
We need to put in the amino acids. Dopamine is based on tyrosine. Its antagonist, which is serotonin. Prolactin and serotonin are both based on tryptophan. So first of all, we need to put in the tyrosine. We need to put in the copper, because copper and vitamin C interacts with the tyrosine and the amino acids to make dopamine. But the tyrosine is super important. I knew a biochemist who had his own supplement company. He closed down in 2010. Dr. Dews. And Dr. Dews had this really nifty formula that he never let anyone know. He carried it around on one of those memory sticks in his pocket around his neck. He never printed it out. He never put it on his computer, but he would make it, and he would have it made. And it was a tyramine, an amino acid, vitamin C, and something else. And for those folks who were low on all the stuff used to make dopamine, it would be a godsend. They'd take 1 or 2 capsules in the morning, and they'd be flying throughout the rest of the day. We need to put in the building blocks of what we're looking to make in order to be able to make it. Just like we need to put in the bad cholesterol to make the testosterone, we need to put in the tyrosine and the vitamin C and the copper. And I actually don't like copper. If you read Dr. Larry Wilson's work, Larry Wilson was a U.S. Health Department doc who actually quit his job because he ran into all the files they were trying to keep secret from the real reason why fluoride is put in the water for mind control, from the real reason why this was done and why that was done. And he just couldn't take it anymore, and he quit. He's since been a natural practitioner in northern Arizona. He's got a book that you can download from the internet called Copper Toxicity Syndrome, and I highly recommend it to everyone. It's how copper builds up in the brain. Its antagonist is zinc, and we don't need enough zinc, so we can't chelate out the copper. So I'm very careful about telling folks to supplement copper, but copper is necessary for both making of the dopamine and for making of the serotonin.
Okay, so we have, 5 things: testosterone, dopamine, nitric oxide,
PDE5
inhibitors, and exercise for fitness.
Yep.
So is there a program to increase the testosterone? Is there other than pharmaceuticals to increase testosterone to start with?
Well, again, we get back to a point that we spoke of in our last show. 50% of the men who've gone into andropause go into andropause because they stop making luteinizing hormone in their pituitaries. The luteinizing hormone is what tells the testicles to start making testosterone. And then 50% of men go into testicular failure. So for the guys who stop making luteinizing hormone, we can put in the herbs, including the herbs like ashwagandha that has its own luteinizing hormone, and that helps make dopamine. And then we can put in the mucuna purpurans that really makes dopamine and even has dopamine in it. Then we put in the herbs like the maca. We put in the medium chain triglycerides, and we can make testosterone from all that successfully. In other words, we can circumvent the luteinizing hormone not being produced by the pituitary by throwing in the luteinizing hormone, and the testicles just take all the building blocks and make testosterone. In the guys who've gone into testicular failure, we can do that all day long and nothing's going to happen. They already have a fairly high level. If you tested the luteinizing hormone, they've got a ton of luteinizing hormone floating around because the pituitary is trying to kickstart the testicles, but the testicles ain't lifting. Factories shut down, ain't nothing coming out of there anymore. So for those guys, they absolutely have to go the medical route.
Okay, so if starting say 30, 35, you could go the herbal route, right?
Yes, yes, right.
Does that make sense?
Yes, it does. Yeah, and then
Okay.
somewhere between 45 and 50 for half the male population, that will begin to wane.
Oh, so then at some point in time, they may have to go to a pharmaceutical?
Yes, exactly. Yeah, half the guys will. Yes.
Okay. All right. So that covers somewhat about testosterone, but we need the dopamine. So the dopamine, this desire to have sex and so forth.
Mucanopurins.
Pardon me?
Mucanopurins is
Okay.
an herb that is 20% L-dopa.
Wow.
And in India, it's actually used with Parkinson's patients in natural medicine. In naturopathic here, it's used with Parkinson's patients.
I should have known that name. I sent you an article on it.
Yeah. So the mucuna, however you want to pronounce it, that is our natural source of dopamine. And for most of the guys who aren't Parkinson's patients, that will work. Now, there's oh gosh, not Gary Gordon. What's the doc's? I'm trying to think of a doc's name. Oh, Ward Dean. Ward Dean is I'm sorry.
No, you're good. You're good,
okay.
Dr. Dean.
Yeah, Ward Dean is one of the great granddaddies of the anti-aging movement, and he talks about and Dr. I think Mortimer talk about using bromocriptine, Parladel, and siligoline, Depronel, which are anti-Parkinson's meds, using them in anti-aging for both brain boosting, increasing longevity, because the siligoline appears to increase longevity, and also for helping the body produce more dopamine on its own.
Okay, so just to keep it simple, herbal treatments prior to 50, 60 years of age for testosterone, then you probably, depending on your testing, your symptoms, and so forth, then have to go to testosterone. You can supplement to increase your dopamine. The nitric oxide can be stimulated how?
We take amino acids.
Okay.
Arginine is the most common. I stopped making an arginine supplement because the arginine supplement, the raw material we used to use, has become mysteriously unavailable in the U.S. My suspicion is that it worked too well, so FDA kind of stomped on it. So I went to my old formula, which is what I wanted to build initially before I settled for the arginine. The arginine and the trimethylglycine worked fantastically to make nitric oxide. The new formula, which is what I wanted to do 30 years ago, initially I wanted to make it out of dimethylglycine and trimethylglycine. The dimethylglycine back then was so expensive, the only folks making it were Da Vinci Labs, and each tablet was, I forget how many butts a tablet. The dimethylglycine has now become affordable as a raw material, so that I don't have to pass on a huge bill to anyone trying to buy our nitric oxide making supplement. We should have that one out, I think by the end of, I was supposed to have it out now. We should have it out by the end of next month, so by the end of November. And dimethylglycine is the cat's meow, it is the atomic bomb, it is the whatever of making nitric oxide.
Okay, more so than citrulline?
Oh, citrulline can't touch it.
Okay.
Actually, the action of citrulline, and I used to endorse the citrulline 20 years ago. Citrulline can't come close to arginine ethyl ester, and arginine ethyl ester can't come close to dimethylglycine. Arginine ethyl ester is on par with trimethylglycine, but citrulline is like way down there. Now, let me tell you the reason why supplement companies like citrulline. It is a super cheap as shit raw material that they can hype up to no end and make a really great profit out of selling the crap. And if you're If you're 25, 30, it'll work. It'll work. Yeah, it'll work great. If you're a little older than 35, it might not work so well. If you're older than 40, it might not work at all. It works for some guys, it doesn't for others. The dimethylglycine, the trimethylglycine work for everyone. The arginine ethyl ester works for just about everyone.
All right, and there's two things that I've heard you talk about before, and then I know Dr. Smith has some questions for you: zinc and magnesium.
Mm-hmm.
How do they fit into this program?
They are cofactors for making every hormone, from insulin to testosterone. You cannot make a hormone without zinc and without magnesium. Also, the prostate is the most zinc-rich organ in the body. Each ejaculation, we lose 15 to 30 milligrams of zinc, which is equal to the RDA. So how many orgasms have you had? How many ejaculations have you put out? How much zinc have you lost? To the point where it was, I think, Dr. Kurt Donsbach who first said that all prostate and zinc swelling starts off as all prostate swelling starts off as a zinc and vitamin E deficiency. And before he did anything about the estrogen, he would take care of the zinc and the E. Now, these days we have to be really careful because most vitamin E is made from soy, and it still has estrogen in it. The only company that absolutely for sure has a de-estrogenated vitamin E is the AC Grace Company. I think they're in Sugar Land, Texas.
Okay. So, all right. So, in addition to everything else, a good supplement of the minerals zinc and magnesium.
Yes.
And one thing you did not mention is HCG.
Human chorionic gonadotropin. I like that stuff, especially for guys. Here, let me give you a for instance, without mentioning Arnold's name. I won't mention his name. I won't mention his name at all, so that you won't know who I'm talking about. You just won the Mr. Olympia so many times. You've been on roids since you first won the Mr. Universe Amateur in 1968. But now you've retired. You're about to marry into the Kennedy family, and you want to start having kids. You need to get your testicles, which had shrunk throughout time, and Arthur Jones measured the shrinkage in the testicles while he was training at the Nautilus Center in DeLand, Florida. And I just can't picture. Ellington Darden talks about this, but I just can't picture taking a micrometer to this guy's balls to see how much they shrink every week. But he was now the therapeutic dose for Dianabol is 1 tablet QID, one 5 milligram tablet 4 times a day. He was doing 12 to 25,
wow,
plus other stuff. They hadn't started stacking. They hadn't gotten really sophisticated in anabolic steroid use back in the early 70s when this was going on. But 12 to 25 Dianabol a day. That's how many times the therapeutic dose. So you can imagine he had a lot of testicular atrophy from that. Okay, so he finds a really great doc in California who's been managing pro athletes, pro football players, bodybuilders, and Olympic athletes with hormones forever. That's all this guy does. And he starts them on the HCG every other day. Or he gives him one huge dose along with, what's that other, it's the menopause hormone, once a week. And the testicles grow back to full size. He's got 3 kids. And he made another one with a Mexican housekeeper. So 4 kids. At least that we know of. So it started working again. It came back. Dr. Shippen, who wrote the testosterone syndrome, early on proposed the use of human chorionic gonadotropin once every other day or once every day to stimulate our own production of testosterone. That didn't quite work out. I don't know why. I haven't seen the studies as to why. My thinking is he got very little patient compliance because giving yourself a shot every day is kind of a pain in the ass. So that's my only experience with HTG.
Okay. Well, one other drug I want to just throw in here. Any experience with Clomid or Clomid?
No.
Not at all. It's supposed to increase luteinizing hormone and whatever. Okay. Well, that's for. I know some of our listeners have asked about that, and I'm not that familiar with it myself. Although I know people have taken it to increase their testosterone levels.
Cool.
It's an estrogen blocking hormone. Okay, Dr. Jerry.
Yes, sir. What's interesting, I was spending about $250 a month from my compounding pharmacist with his little formula for the replacement hormones, testosterone. Anyway, I have a very sophisticated electronic device called CyberScan, and I start cloning it. So in other words, I would take the actual testosterone from the compounding pharmacist, import the frequency into the database, the human growth hormone, import that, and I put some procaine in there. Anyway, and then I imprinted that mixture into MSM cream because I think MSM cream supplies methyl groups. Long story short, I had an 80-year-old patient whose testosterone was at 200, and after 3 months, his blood test showed 711 just by topical application.
Cool.
So we're doing it with frequencies.
That is the perfect example of what homeopathy should be.
Yeah.
Yep.
So
Exactly.
I know I have a bunch of guys up in Canada that are running around looking for their neighbors. Oh, I'm kidding. But,
now, and that's one of the problems we never think about. At least I never did until I'm standing there, horny as heck, first thing in the morning with a tent going, "Where's a woman? Gotta find a woman."
But yeah, it's really interesting. I've been playing around with the frequencies and the cloning different things, and it seems to be very powerful. But I just had a couple questions on some of the key herbs like tribulus. Any feedback on use of that for enhancing like libido or your vitality, stamina?
Back in, when was it? I think 02 or end 03, when I was looking to create particular herbal blends, we got tribulus from I think 2 or 3 different raw material suppliers. Started taking it as recommended. Gave it out to my friends just either in little packets of the powdered herb, or we encapsulated it in a little encapsulator, and we were taking, I think at the high point, like 3 tablespoons of the stuff a day, and nothing happened. Now, my test group was in their 40s and 50s. Maybe it'll work for younger folks. It's supposed to work for old guys because that's what supposedly the Malaysians and the Indonesians use for older fellows who have sexual problems. But we couldn't get it to work regardless of the raw material supplier, regardless of the grade, and it was all stuff from Indonesia and Malaysia, so it was supposed to be the best raw material around. We couldn't get it to do anything.
Probably the source maybe wasn't really high quality. That's a possibility.
It is a possibility. The raw material suppliers were all telling me it was pharmaceutical grade. I don't know.
Yeah, because same thing with ginseng. Like the U.S. ginseng is like neutral. It's not even worth taking and spending the money on. If you go to the Korean or the Chinese, hopefully it's not filled with lead or any other chemicals or poisons. Yeah. But the source is really important. I was just talking to someone about cordyceps, and he said the best cordyceps is from China. And I just found a source to get some good stuff because the others are not grown at high altitudes and don't give you the stamina and the oxygen levels that you really need.
Right. Yeah. Where an herb is cultivated is super important. Maca is a great example of that. The highland maca from the mountains of Peru does everything maca is supposed to do. Maca is also grown in the Amazon lowlands in Brazil, and that maca does practically nothing. It's the same vegetable, but somehow the properties are different depending on where it's grown.
What's your feeling on the use of pycnogenol to stimulate endothelial nitric oxide synthetase?
Oh gosh, we did that, and right now I can't. I'm having a senior moment. I'm sorry.
Okay, no problem.
That file is not accessible.
Did it work?
There's another herb, scarbrosa. It's an herb called scarbrosa. It's supposed to inhibit the phosphodiesterase 5. Have you had any experience with that?
No.
Okay.
I've never played with that one.
How about with all the stress in our high-speed living, the effect of cortisol on your hormone levels?
Well, with most folks, the cortisol eats up your progesterone because that's what you use to make the cortisol from. If your progesterone goes down, your estrogen goes up. It means your testosterone goes down. So, having high cortisol levels begs you to use supplemental progesterone, which most folks need anyway, guys and gals, because progesterone acts as an aromatase inhibitor, along with the other aromatase inhibitors, to keep testosterone from converting into estradiol or estrone. So, but having said that, I think that if we take most folks, let's say I've got an adrenal exhaustion patient, and I'm thinking now of Dr. Abram Burr. If you've ever heard of Dr. Burr, he was the world's leading homeopath. The guy was a saint. I not only worked in his office, he was a patient of mine. He had Addison's and lost 30 pounds. We put 15 pounds back on him with diet, exercise, and proper supplementation. But then he got on the cortisol kick, and he started taking an anti-cortisol herb, and he started feeling like crap. And I looked at him, and I said, "What are you taking that for? It's decreasing your cortisone, because that's what you make cortisone from, right? Okay, it's the next thing up." And he thought to himself, and he goes, "Oh my God, I never thought about that." We get into reading about how bad cortisol is and what cortisol does, but we kind of forget that it's part of the body's primary anti-inflammatory system. And in adrenal exhaustion patients, certainly in Addison's patients, we shouldn't go around lowering cortisol because we're just making the symptoms worse. We're making the whole condition worse.
So that's where the adaptogenic mushrooms, the cordyceps, come in handy to give that adrenals a chance to relax and heal, calm down.
Mm-hmm. Yep. Yeah. One of the things that we did with Dr. Burr is we did something that I was always taught was impossible. We did it anyway. He came out of the hospital. He was 56, I think he was. Had lost 30 pounds. Had zero adrenal function. He was on hydrocortisone and a whole bunch of other meds. Using the progesterone, using IGF-1, he was also using his own HGH. And what else did we do? We increased he basically regrew his adrenals somewhat, not all the way, but he got back to like 40-50% adrenal function. And he lasted another so many years. He just passed away about 3 years ago in his 70s.
Well, it's interesting. Standard Process has protomorphogens, and they're made from desiccated bovine, glands. And supposedly the philosophy is provides a genetic blueprint for repairing the organs. Have you gone that route?
I think we did use glandulars,
Mm-hmm.
but you brought this up, and I know that you're into the Spooky 2 instrument. I'm into an instrument somewhat like that from the Earth Pulse folks. One of the things that I found that those pulsed electromagnetic frequency instruments do, that they restore tissue to their proper DNA blueprint. I can swear to you that I am rebuilding my substantia nigra, which is supposed to be impossible to do, by sleeping with that thing every single night. I can also swear to you that other things are regenerating. Now, this is just me. It's a sample of one, not a valid study. But so let's say we put in the glandulars to give the body a blueprint for rebuilding. And let's say we put in the progesterone and the IGF-1, which in infancy, in the womb, those are the two things that caused us to grow the organs in the first place, right? Progesterone and IGF-1. And then we put in the pulsed electromagnetic frequencies to strengthen and reinforce the, let's say, the roadmap or the DNA blueprint. What if we did all those things and then put in a touch of testosterone, because testosterone is the other hormone that helps us grow? What could we do with regenerating organs, especially organs and things that aren't supposed to be regenerative because they don't have ribosomes? We already know NYU back in the 90s was relinking spinal cords using IGF-1, HGH. They were injecting polysorbate 80 to keep the ends of the spinal cords from scarring up. And now we see with the pulsed electromagnetic frequency therapy that they're actually causing nerve trunks, which also don't have ribosomes, to regenerate. So what if we threw all this stuff together, the electronic stuff, the glandular stuff, the natural stuff, the hormone replacements, and threw it all together in a really well-thought-out blend to help regenerate a person? How long could we live then? But not only live, how healthy could we be?
We'd have no friends, though. That's the problem.
Yeah. Hell, all of my friends have died out.
Right. Just a real quick, throw your curveball. We talk about the men problems, but I know women have serious issues also.
From 35 on, most gals don't want sex.
That's what I mean.
Yeah, this is what breaks up most marriages. The old saw is that marriages end because of financial failures. No, marriages end because the couple isn't releasing dopamine. No, excuse me, isn't releasing oxytocin in each other anymore. When a woman has a baby, she has this huge release of oxytocin, immediately bonds her to the child. When a couple is giving each other orgasms during sex, they're bonding each other to each other. When sex isn't had, that bond breaks down until it gets to the point where the guy's still horny at 35, 40, 45, but his wife has had 2 or 3 kids. She's got high estrogen. She's got high prolactin because the hormones have never come back from having postpartum depression. They never went back into proper balance. So the marriage breaks up because the guy goes off and has his midlife fling. He's looking for the leggy blonde. He buys himself a sports car, and that's the end of the story. How many marriages could we save? How many relationships could go on indefinitely if we helped each person in the couple to release dopamine in each other? If we help the gal to still be horny after 35, if we, just getting rid of the prolactin left over from breastfeeding would immediately change her outlook, get rid of the depression, and lower her estrogen levels, because high prolactin is always found with high estrogen, whether it's a pituitary tumor patient or whether it's a gal with postpartum depression.
It's a shame we can't can it like Ensure.
That would be great, wouldn't it?
Right.
And have it in a very nice container.
Yeah. Make it all nice and pink and yellow and flowery and stuff. Yeah, that'd be great.
All right, Dr. Wong, let's just try and just see where we've been. We've talked about testosterone deficiency, which has both physical and mental components. Would you say that the erectile dysfunction would be at the bottom of the list, or in the middle of the list, or top of the list, and people that are starting to have symptoms of testosterone deficiency?
Probably the middle.
Okay, so the grumpy mood, joint pain,
right, getting fat around
all
the
that
middle.
stuff, around the middle.
Dr. Wong, that's what they call sperm backup.
Deadly sperm buildup. Yes.
Yeah.
Right. Yep. Been there.
One quick question, because I know we're getting towards the end here. If you take a food-based vitamin C, like from Indian gooseberry or camu fruit from South America, the copper, it's the organic form of copper, it's tyrosinase. Would that be a problem?
Dr. Wilson would be the person to ask that question of. I don't know. And I think Larry used to do shows. Larry used to do interviews. I haven't seen him since the Naturopathic Convention in Phoenix in 1990. But he's still in Prescott, Arizona. Look him up, drop him a line, and ask him to come on.
Okay, Dr. Wong, just to finish up now. So say we do, you realize you need supplementation. You get adequate supplementation, both plant-based, vitamin-based, and even pharmaceutical grade. What would inhibit that from being effective? In other words, how about smoking? How about if you didn't lose weight? How about coffee?
Well, coffee is a really interesting one. Let's take a look at the two largest studies that covered coffee. The first one is the Hawaiian Men's Health Survey, started in 1973, with I think it was 9,000 men of Japanese Hawaiian extraction. And then the second one was the Nurses Healthcare Survey. Both of those studies are still ongoing. But after in 1999, the initial results of the Hawaiian Men's Health Survey were published, and on coffee, it was this: of the non-coffee drinkers, most of them started getting dementia or Alzheimer's in their mid to late 60s. Of the coffee drinkers, hardly any of them got dementia or Alzheimer's. The very few that didn't get it until their late 70s. The Nurses Health Survey, which was like 18 to 20,000 nurses, again, the study is still ongoing. The surprise there was that 6 to 8 cups of coffee a day virtually eliminates ever getting diabetes. That just floored everybody. Also, the other thing that the Hawaiian Men's Health Survey found was that the soy eaters, the tofu eaters, all had shrunken brains, and those who didn't eat soy and tofu did not have shrunken brains.
Wow. Well, Dr. Jerry doesn't drink it. I love my coffee, and we've had some programs on the benefits of non-pesticide type coffee, so you're not going to find any argument from this host. But do you think coffee increases your estradiol?
Yeah.
Do
you think?
Actually, I don't know. I have looked at. There is a chart on drwong.us in the Health Articles archive called Phytoestrogen Food Sources. That chart was taken directly from a Canadian Natural Oncology journal on the estrogen content of various different foods. And if I remember right, coffee was low single digits, way down at the bottom of the list. Top of the list, the worst offender was flax.
I'll check that again. I just had a conversation with Dr. Hertog, and he did mention that coffee would be one of the things that he would advise against in a testosterone program. That's all. We didn't get much more into that.
Well, just quickly, would you recommend like the Jamaican Blue Mountain versus any Peruvian coffees? Do you have any special blends that you like?
I love the Sumatran. I love the Hawaiian Hamakua and the Hawaiian Kona coffees. The significant thing about the Hawaiian Men's Health Survey, if you've ever been to Hawaii, if you've ever seen the way they drink coffee, think of a 16-ounce coffee mug filled with espresso.
Wow.
That's about what Hawaiian coffee is like. It's not like North American coffee at all. The Hawaiians drink coffee that you can write with.
I'd have to get 4 girlfriends.
Yep. You can take Hawaiian coffee, fill a fountain pen with it, and write with it.
All right, I can't let you go without some concrete recommendations. Zymescence has a place in this program. Would you not agree?
It keeps your circulation open.
All right.
It lyses away, it eats away at all the fibrin blocks in the micro and macro circulation. So if you still want to have the same amount of circulation in your nether regions, you better take the enzymes.
And what other product that you are making now would fit into this program?
We actually have 2 products to make testosterone, and I divided them into 2 products because the basic principle is this: whether it's in pharmacy or it's in nutritional pharmacology. When you throw too much stuff in to one product, you'll never have any particular ingredient there in a therapeutic level of dosing enough to cause a physiological effect. If I need 1,500 milligrams, if I need 1.5 grams of a particular herb to create a particular effect, if I only got 100 milligrams, yeah, it looks good when I read the label that I've got this stuff in it, but it ain't going to do jack shit. So I had to divide it up into 2 separate products. The Anti-Essence Max and the Enkindle are meant to go together because the 2 products, each one of them has 2 herbs in it. They are there at a therapeutic level of dosing. They are there in a dosing sufficient to cause a physiologic action. And they're there to make both the luteinizing hormone and to give you the wherewithal, the sterols, to make the testosterone.
Okay. Dr. Wong, I'm going to impose upon you. I see Dr. Dan's online here. Just see what he...
Sure.
Dr. Dan, you have anything for Dr. Wong?
Hello, Dr. Wong. How are you?
How are you, sir? Good to talk to you.
I'm still alive. Just about, but I'm alive.
Good. Good.
I was thinking about you did mention Viagra and Cialis and Levitra and so forth and so on. Not too much was mentioned about these. Are they really of good use in the situations where things are not working well for you at the older ages, or are they dangerous, or how would you look upon them?
You know, I actually tested it out. Let me preface what I'm about to say by saying that, with one exception that I can think of, all of the herbal pro-erection products that actually work, most of them don't, but all of the herbal pro-erection products have Chinese Viagra or Cialis snuck into the formula, which is why the FDA has come in and shut most of those guys out of business. The one exception is Dr. Chi's Super X. He's got an all-herbal formula that takes about 4 to 6 hours to kick in, and it works fairly well. What the PDE5 inhibitors were first invented to do was to open up the circulation in the brains of Alzheimer's patients. But when they tested this with the Alzheimer's patients, guys, they all got woodies, so they knew they were going to make more money out of erections than from Alzheimer's. But I have tested the Cialis at 50 to 100 milligrams a day for extended periods with no ill effects. My circulation was great. The standard dose for pulmonary hypertension is 50 milligrams a day, every day. I have not found any problems. Now, the Viagra, the reason for the blue vision isn't the PDE5 inhibitor. It's the blue coating on the pill. So if you
scrape it off.
Yeah, exactly. If you just scrape off the blue coating, you won't get the blue vision. But I have yet to find any dangers from the PDE5 inhibitors. And like I said, I tried them at fairly high doses. You know, so the starting dose of Cialis is 10 milligrams. Most guys do okay between 10 and 20. I was taking double the pulmonary hypertension dose and no ill effects. I could have sex whenever I wanted to, but no side effects.
You sound like a German prisoner, that you volunteered to test.
Exactly. Yes. Exactly. Exactly, huh?
God.
All right, Dr. Dan.
Yeah. Just,
right. We covered a ton more information than I think a lot of our listeners absorbed today. So we're going to have to come back at some point and just break it down into 4 or 5 areas where they could absorb and then have an action for those 4 or 5 areas. But this was a great program, Dr. Wong. I really appreciate your being on today.
Thank you. Thank you for having me on board.
Oh, we love you, and our audience loves you. We have great attendance when you're on, and we do repost these shows on Facebook and YouTube, and hopefully we get some hits on them. We just started the YouTube channel. But Dr. Jerry, I'm sorry. Go ahead, Dr. Wong.
I tell my folks on YouTube, I give them the link to your shows, to our shows together on my YouTube channel.
All right, thank you for that, and I'll do that too, because like I say, I'm new to this. So I will start linking your shows and some of your websites, like Zymessence and Dr. Wong. Well, I have them down, U.S. and so forth.
Thank you.
Well, I just wanted to share with you, Dr. Wong, I want to share with you, I just came back from Markham, Ontario. I was lecturing to the World Organization for Natural Medicine, and one of the topics that I discussed with them was anti-aging, and I went through your scenario of the different age groups and what happens, the breakdown in Zymessence. So hopefully I think you'll get a lot of orders for Zymessence because...
Thank you very much. Thank you.
It was my pleasure. Let me tell you, these people's eyeballs rolled around like a slot machine because I said there is nothing out there that's going to solve the anti-aging problem like Zymessence, because what the heck is the problem? It's fibrosis. You shrivel up like a prune. If you don't take care of that, you can take all the fancy vitamins you want.
Bingo. Exactly. Yes, you hit it exactly on the head. Yes, exactly. Bingo.
Well, that would call for incoming. Well, Dr. Wong, thank you, and I hope we can do this again at some point in time. I know that it takes up a lot of your time, and you're a busy person. Dr. Dan, Dr. Jerry, I think that we had an interesting and informative show today, and I don't have anything else for Dr. Wong except an attitude of gratitude and thanking him for his time, and I'm sure our audience has really appreciated this program. So thank you, Dr. Wong. God bless you.
Very well.
And
God bless.
we will have you back again. So with that, we are going to close, ladies and gentlemen. Close episode number 281. Incredible that we've been here. Dr. Dan, thanks for getting on here today. I know you had a fight to do that. And
You're
Dr.
welcome.
Jerry,
thank you.
I will. We'll be talking. Okay, everybody. Ciao.
Ciao. Arrivederci.
God bless, folks.
God bless you.
Hey, ladies and gentlemen, you've been listening to Dr. Ron Unfiltered, Uncensored here on Blog Talk Radio. Episode 281 now in the can with Dr. William Wong and the 4 things necessary for sexual function. Hope to see you next week. We'll be talking about CBD, cannabinoids, and how to reset your endocannabinoid system. Ciao.
I'm Jay Farner, CEO of Quicken Loans, America's premier home purchase lender. We've created a new way to protect you from unpredictable interest rates. Our exclusive Rate Shield approval. First, we lock your interest rate for up to 90 days. Then, if rates go up, your rate stays locked. But if rates go down, your rate drops. Either way, you win. Call us today at 800-QUICKEN or go to rocketmortgage.com.
Rate Shield approval only valid on certain 30-year fixed-rate loans. Call for cost information and conditions. Equal housing lender. Licensed in all 50 states. NMLS number 3030. Additional conditions or exclusions may apply.
I'm Jay Farner, CEO of Quicken Loans, America's premier home purchase lender. We've created a new way to protect you from unpredictable interest rates. Our exclusive Rate Shield approval. First, we lock your interest rate for up to 90 days. Then, if rates go up, your rate stays locked. But if rates go down, your rate drops. Either way, you win. Call us today at 800-QUICKEN or go to rocketmortgage.com.
Rate Shield approval only valid on certain 30-year fixed-rate loans. Call for cost information and conditions. Equal housing lender. Licensed in all 50 states. NMLS number 3030. Additional conditions or exclusions may apply.